Good morning, Tony Maritato here. Welcome to the Total Knee Replacement Support Group YouTube channel. In this video, I want to answer the question, why is your knee still so swollen weeks, months, years after a total knee replacement? So recently I had the great fortune of having Dr. Andrea Leifer on the channel. She provided a closed class live talking about lymphedema. She is a lymphedema specialist. If you want more information, you can find her in the group. I'll post a link to her profile in the description of this video. But basically, one of the things that she mentioned was, hey, there's lymphatic vessels all throughout the lower extremity. And if we don't understand how these vessels are disrupted during surgery, we don't totally understand why we continue to have circulatory issues, swelling after surgery, months and years after surgery. So what I want to do is, behind me on the screen, I've got a plain Google website open. I'm going to do a quick search, lymphatic, let's see here, system around the knee. And we're going to take a look at some pictures. And I encourage you guys to do the research, because the more you understand about the condition, the more you understand about what's going on. So while this is an illustration behind me on the screen, let me see if I can actually zoom in on this a little bit better. What we're looking at here is a representation of the lymphatic vessels. Now, clearly this is not real life, this is a representation, but still I want you to kind of imagine for a moment when your surgeon makes the slice superficially down the center of the superficial knee and then around the kneecap, what actually happens is they retract the skin and the soft tissue on both sides to expose the bony structure that they're going to replace. When they retract these tissues, it causes damage, whether it's temporary damage or long-lasting damage, to everything, to the nerves, to the blood vessels, to the skin, to the musculature. And so you can see the lymph nodes, you can see the lymphatic vessels. You can imagine that when that skin and soft tissue is retracted, those blood vessels and lymphatic vessels are potentially pinched, torn, damaged. And then when everything goes back together, it will take time for those vessels to recuperate. Some may never come back to normal operational function, but the idea is that I want you to see a representation of this. Now let's talk about why some people continue to have pain around the knee, numb spots around the knee. I'm going to use the same method here. Basically what I'm going to do is I'm going to go back to Google. This is something that you guys can do. Nerves around the knee, and we're going to go to images. And so let's take a look at this image. What I'm going to do is I'm going to zoom in here on it. And again, these yellow lines are representative of nerve endings, nerves that surround the knee. You have nerves behind the knee. Those are generally uninterrupted because the kind of access to the knee is done through the front anterior, but you can see all of these little skinny kind of superior genicular nerves. There is a procedure where they freeze or burn the nerve ending so that it decreases the sensation and the information coming back to the brain. That procedure could last 3 to 6 months. Some places are doing it as part of the surgery. Some places are doing it even before surgery, but nonetheless, you see the nerves that wrap around the fibular head, which is the outside of the knee joint. These little cutaneous nerves are all through there. So you have nerves in the skin, you have nerves in the fascia, you have nerves deep to those structures. When we cut through the superficial layer, when we cut around the kneecap, when we pull everything to the side, those nerves, the lymphatic vessels, the blood vessels, the multi-layers of connective tissue, all of that is interrupted. And with that interruption, it takes time for that to recover. So I want you to understand while no, this information isn't going to cure your swelling, cure your lymphedema, cure your pain, at least it brings you a little bit closer to understanding why you have it. Now, the next question is, well, why does your knee hurt, or why is your knee red, hot, swollen, when your neighbor down the street who had a knee replacement doesn't have the same problems? We don't know. We just don't know. Potentially your procedure was more involved. Potentially the way your body responded to the procedure was different than that person. You might be younger and healthier. We still don't have any good correlative data to say this is what we expect. Every single time we go into it with a fresh set of eyes and we're a little bit surprised. Some people recover incredibly well. Some people struggle. Nonetheless, my hope for you is that I can bring you the educational material that helps you at least better understand what's going on, why it's happening, and have some sort of control over it. Guys, thanks so much. I'll catch you on the next video.